Bladder Cancer by Raleigh Sykes and Leah Pereira. Also, I apologize, I'm a bit congested right now. Symptoms. In most cases, blood in the urine is the first warning sign of bladder cancer. Sometimes there is enough blood to change the color of the urine. Depending on the amount of blood, the urine may be orange, pink, or less often darker red. Sometimes the color of the urine is normal, but small amounts of blood are found when a urine test is done because of other symptoms or as a part of a general medical checkup. Some more symptoms are being unable to urinate, lower back pain on one side, loss of appetite and weight loss, swelling in the feet, and bone pain. The bladder, as an organ, is hollow and it's in the pelvis with flexible muscular walls. The bladder's main function is to store urine before it leaves the body, and the average adult bladder is able to hold up to about 2 cups of urine. Urine is made by the kidneys and then is carried to the bladder through tubes called the ureters. What is bladder cancer? Bladder cancer is most commonly found in older people, with about 9 out of 10 diagnosed with bladder cancer over the age of 55. Sorry about that. The average age, the time of diagnosis, should be 73 years old. Men are around 3 to 4 times more likely to develop bladder cancer than women. The chances of a man getting cancer in his life are 1 in 26. White people are diagnosed with bladder cancer almost 2 times as often as black people. However, black people are more likely to have an advanced form of the cancer upon diagnosis. Three main kinds of bladder cancer. There's transitional cell carcinoma, and then there's squamous cell carcinoma, and then adenocarcinoma. The first one is the most common type of bladder cancer in the US, and it occurs in the transitional epithelium. The second one is when squamous cells, which are cells that appear in the bladder as a response to infections, become cancerous. This is a pretty rare form in the US. Adenocarcinoma is, hold on. Adenocarcinoma occurs in the cells of the mucus, which are secreting glands found in the bladder. This form is also pretty rare. What causes bladder cancer? It is unknown what causes bladder cancer exactly, although certain risk factors have been identified that are associated with the development of the disease. Smoking is considered to be the most important risk factor, with smokers around 3 times more likely to develop bladder cancer. Risk factors including bladder defects from birth, chemotherapy and radiation therapy, chronic bladder infections and irritations, low fluid consumption, personal or family history of bladder cancer, and smoking. Some treatments. A process called staging determines what stage the cancer is currently at and how it should be treated. CT and MRI scans are used in staging process. Bladder cancer in its early stages can be cured. Surgery. There are 4 different kinds of surgeries to help get rid of the bladder cancer. The first one is transurethral resection. A cystoscope is inserted through the urethra and into the bladder, where it burns or scrapes away any cancerous tissue. Radical cystectomy, I think that's how you say it, is removing the entire bladder by surgery along with any infected tissue or organs nearby. Partial partial cystectomy for patients with low-grade cancer. Sorry. Partial cystectomy is for patients with low-grade cancer and only cancerous tissue in the bladder is surgically removed. Urinary diversion is surgery that allows urine to pass through a different route than through the bladder. And here's some images depicting the different ways that the cancer can be treated. we have a very detailed picture right here. Sorry, a very detailed picture of the surgery with the cytoscope that burns away or scrapes away the cancerous tissue. And then the therapy. There's radiation therapy, which uses high X-ray radiation to kill cancer cells and prevent new ones from growing. And then we have chemotherapy, which is drugs used to kill the cancer cells and prevent, that's supposed to say, oh wait, no, that's right, I'm so sorry. That's, okay, and prevent division. And then there's biologic therapy. The patient's immune system is boosted and directed towards cancer cells. And there's our bibliography. Thank you.